Hi guys, welcome back to Fairies Tutorials. In today's episode, we'll be looking at the health conditions that are associated with the improper intake of proteins, fats, and carbohydrates. Stay tuned. Section 2, Nutrition and Health. In today's episode, we're looking at Content 5, which has to do with the health conditions associated with the improper intake of carbohydrates, proteins, and fats. And we know that those are the macronutrients that are needed in the body in large amount. However, when there's an improper intake, which means we may take too much or too little, there are certain health conditions that are associated with the lack of or taking too much of these important nutrients. Now, let us look at the different health conditions that we're going to look at. Now, as it relates to carbohydrates, we're going to look at the effects of obesity, low energy, constipation, diabetes, diverticulous, cardiovascular diseases. As it relates to fat, we're looking at the conditions of heart disease, high cholesterol, stroke, and hypertension. And finally, with proteins, we'll be looking at protein energy malnutrition or protein calorie malnutrition, kwashiorkor, marasmus, and also excessive weight gain. All right, let's kick things off with the health conditions associated with the improper intake of carbohydrates, right? Now, overweight and obesity is the first health condition that we'll be looking at, and this may be defined as a condition in which excess body fat has accumulated to the extent that it have a negative impact on health, leading to reduced life expectancy or increased health problems. Good. Now, how does obesity affect one's life, right? So we speak of when someone is obese, they are prone to having heart attack, high blood pressure, arthritis, depression, joint problems, breathing problems, high cholesterol, low life expectancy, diabetes, social discrimination, and also low self-esteem. Good. Now, another condition that is associated with the improper intake of carbohydrate, meaning that we're having too little, is constipation, right? With obesity, you know that we're having too much, right? So consuming too much starch will eventually store as fat, right? Leading to obesity, right? Now, the next condition is constipation. Now, being constipated means your bowel movements are tough or happen less often than normal, right? Symptoms of constipation include few bowel movements, trouble having a bowel movement, as in you're straining to go whenever you're supposed to pass your feast days, right? Hard or small stool, a sense that everything didn't come out, swollen belly or belly pain, and also some persons throw up. Now, our next condition that we'll be looking at is diverticulitis, and this is a condition that is associated with improper intake of carbohydrates, meaning that we're not having as much, right? So diverticulosis happens when pouches, which are called diverticula, form in the wall of the colon. If these pouches get inflamed or infected, it is called diverticulitis, right? Diverticulitis can be very painful, and also it is somewhat linked to constipation, because when we're not consuming enough fiber or roughage, what happens is we get constipated and then you strain to go, which can also create pouches in the colon, right? So we have to be very careful. Now let us look at some symptoms of diverticulitis. So belly pain, usually in the lower left side, that sometimes worsen when you move. The most common symptoms are fever and chills, bloating and gas, diarrhea and constipation, nausea, and sometimes vomiting. So persons who have diverticulitis, at sometimes they may have diarrhea, while other times they may be constipated, right? And here on your right of the screen, you can see the colon that is affected, a person who has diverticulitis. So you can see the diverticular, you can see the pouches forming on the colon. Now at this stage, persons have to be careful of what they eat. Like, so for instance, if they eat peanuts or rice grain, like small tiny foods, it can cause a problem because these small particles, just as if you have tooth decay and you have a cavity in your mouth and food gets within that cavity, it's the same principle with the colon of someone who has diverticulitis, right? So particles of food can get stuck and then it can be very painful. Okay guys, now another improper intake of carbohydrates can also be a result of someone having diabetes mellitus, right? So consuming too much carbohydrates can lead to someone having diabetes. Now, what is diabetes? Diabetes is a chronic disease caused by inherited, meaning that we may get it from persons within our family. So if our grandparents have diabetes or your mom, it's a possibility, not all the times, it's a possibility that the younger generation may have this as well. So diabetes may be inherited or it's an acquired deficiency. Now, acquired deficiency in the production of insulin by the pancreas, right? Or by the ineffectiveness of the insulin produced. So the pancreas may not be producing any insulin, and if the pancreas produces the insulin, it is not effective to break down the glucose that is found in the blood, right? And we know that carbohydrates, fruits that are sweet, are also rich in carbs. So we talk about those fruits, those fructose, and also those starchy foods that we can also find sugar in. So if we consume too much, that is why proportion is important. If we consume too much carbohydrates, then it can lead to diabetes. Okay, now there's also heart disease. Now, heart disease generally refers to conditions that involves narrowed or blocked blood vessels that can lead to a heart attack, chest pain, or stroke. Now, other heart conditions, such as those that affect your heart muscles, valve, or rhythm, also are considered form of heart disease. So consuming too much carbohydrates can also, so once we're obese, then that leaves us open of having a higher risk of having cardiovascular diseases, as artery may get blocked because we're consuming too much carbohydrates, which is then later stored as fat because we're not burning those energy, right? And the main purpose or function of carbohydrate is to provide the body with energy. So if we're consuming and not expanding, then we're prone to develop these conditions. Good. Now let us now look at health conditions associated with improper intake of fats. Now let me put it out there, fats is a very important nutrient for our body, right? But if we take an improper intake, meaning if we consume too much, then we are at risk of developing certain conditions. Now, it is highly unlikely that someone will have too little fats, because fats is found in a variety of food that we may not even know as both hidden and visible fats, right? So oftentimes we always have improper intake as having too much rather than too little, right? Now let us look at the conditions. So likewise as with carbohydrates, there's also a linkage with cardiovascular diseases and consuming too much fatty foods, right? Now, what can happen is when the arteries or the blood vessels are narrowed, so we'll have, if it's leading to the heart, then you will have heart attack, things such as chest pain, angina, and if the cerebral artery is blocked by these fats or lipids, then you know the person can suffer a stroke, right? Now, the next condition, as I said before, is stroke. So if the blood clot lodges in the cerebral artery, it can cause a stroke. And whatever part of the brain is damaged, then that part of the brain that is responsible for our bodily signals may also be off as well. Another health conditions associated with improper intake of fats is hypertension. Now, what is hypertension? Hypertension is when a person's blood pressure raises beyond certain accepted levels and remains constantly high, right? And then it is classified as a sickness of hypertension. So why would someone have hypertension or high blood pressure from consuming too much fats? So, for instance, you consume too much fats and then there's a buildup in the walls of the artery. Then the blood will have to force itself through the narrowing of the artery or the blockage of the artery, and therefore the blood pressure will rise. And if there's any lifestyle disease, if there aren't any lifestyle changes, eating habits that are adopted, then that blood pressure will remain constantly high. All right, now let us look at cholesterol. High cholesterol is another health condition that is associated with consuming too much fats, right? Now, cholesterol is a waxy fat-like substance that's found in all the cells in our bodies, right? Our body needs some cholesterol to make hormones, vitamin D, and substances that help us digest food, right? Your body makes all the cholesterol it needs. Therefore, we shouldn't be taking excess cholesterol from the foods that we eat. Now, there is good cholesterol that performs certain important functions in our body, and there is also bad cholesterol. So the good cholesterol is called HDL cholesterol, and the bad cholesterol is called LDL cholesterol. Now, when the LDL levels get high, then we have what is diagnosed as high cholesterol. And you can see in the various images on your screen where there's a buildup. Eventually, persons who have high cholesterol, it will start to build up and form a sticky plaque inside the wall of the arteries that the blood will have to force itself to go through, which develop hypertension. And in severe cases, when there's a total blockage or the cell ruptures, then persons may have a heart attack or a stroke. Okay, now let us look at the health conditions associated with an improper intake of proteins. Now, the first condition that we're looking at is protein energy malnutrition, that we call PEM, right? Or we may say protein calorie malnutrition, right? We can use these terms interchangeably. And an example of these conditions, so when we're lacking protein in the diet, it can cause these diseases, which are kwashiorkor and marasmus, right? And these illnesses or diseases only happen to children, or we may say toddlers, right? Now, as you can see, we have the signs and the symptoms of persons or children who may have kwashiorkor and marasmus. Now, as it relates to kwashiorkor, there is swelling of the legs, which is called oedemia. There is pierced hair, a moon face with little interest of surrounding. This child may have a flaky appearance of their skin, their abdomen may be swollen, and also they have thin muscles but a little fat is present, right? As it relates to marasmus, these children have normal hair, but they have a little old man or a wizened appearance. They have thin limbs with little muscle or fat, and they're very underweight. All right. Now, how is it that consuming too much protein can contribute to excessive weight gain? Do you agree with this statement? Yes. So excess protein consumed is usually stored as fat, right? So if we consume too much protein than our body needs, it will be stored as fat, and as a result, then we can we can become overweight, which can also lead to obesity. And if we think about it, even protein foods from animal sources, from animal sources, majority of those foods have hidden fats and are high in saturated fats as well, right? And saturated fats is the bad fat. So while the surplus of amino acid is excreted, excess protein is stored as fat in the body. Now, this can lead to weight gain over time, especially if you consume too many calories while trying to increase your protein intake. Now, please remember that just as how carbohydrates can contribute to obesity, consuming improper intake of proteins can also contribute to obesity as well, or being overweight, right? The calories in food come from where? Carbohydrates, proteins, and also fats. Now, a gram of carbohydrate is 4 calories. Likewise, a gram of protein also contain 4 calories. So we have to be very careful. So even though protein is good for us, and yes, it builds and repair body tissues, let us think about it. Fat is also included in these sources, even like milk. So you know that milk have hidden fats, cheese, meat, those streaks, those nice marbling technique that you may find in a nice cut of meat, right? All of those are also high in fat. So consuming too much protein can definitely lead to excessive weight gain. Now, let's take a look at the daily intake of macronutrients. So the macronutrients are, just to recap, carbohydrates, fats, or we may say lipids. So lipids is another name for fats, and also protein. Now, the percentage of each nutrient, carbohydrate, we should consume about 45% to 65%, fats 20 to 35%, and protein 10% to 35%. All right. Now let us look at our questions. Question 1. Samantha is 50 pounds overweight. In an attempt to lose 50 pounds, she reduces her intake of carbohydrates. Discuss 2 effects of the inadequate consumption of carbohydrates on Samantha's health. And also describe in detail how a person may become obese from an excessive intake of protein. You're awesome. You've made it to the end of the video. Don't forget to like, subscribe, and also share with persons who you know will find this information useful. Thank you for making it Fairy's Tutorials.